Medical social workers commonly work for hospice, home health, or other managed healthcare organization. Providing clinical patient assessments are the core responsibilities of a medical social worker, thus they may also be called clinical social workers. These professionals typically work with doctors and other healthcare staff to evaluate the physical and emotional health issues and social factors that play a part in a patient's treatment plan. This is generally performed by monitoring patients' health conditions, writing clinical reports, and reporting findings to patients' healthcare team. Medical social workers also perform discharge planning, which often includes utilizing various community resources that can provide patients with financial and social assistance. Working with patients' families to advise on proper discharge care and coping techniques is also important. Medical social service workers must often travel to job sites and may work long evening and weekend hours. This job can be quite stressful because understaffing often leads to large caseloads. A master's degree in social work is required, along with 1 to 2 years of social work experience. Licensure is required in all states. Key skills include active listening, communication, interpersonal, problem solving, time management, and good judgment skills. According to the U.S. Bureau of Labor Statistics, healthcare social workers made a median annual wage of $54,020 as of May 2015. Let's take a look at the steps to become a medical social worker. Step 1. Obtain a bachelor's degree. Aspiring medical social workers typically earn a Bachelor of Social Work, BSW. However, students who major in psychology or sociology may also be qualified to work in social services at an entry-level position. Undergraduate and graduate programs are accredited by the Council on Social Work Education. Accredited BSW curricula can require up to 400 hours of field experience, in addition to the classroom coursework. Step 2. Gain work experience. Graduates can choose to work as a general social worker after receiving their BSW before going on to specialize in medical social work. Prospective medical social workers may consider seeking entry-level employment at state social services agencies to gain experience in handling multiple caseloads and helping clients with finding financial or job-related assistance. They may also work at mental health or substance abuse treatment facilities to become familiar with working in clinical settings, dealing with clients who may have emotional problems, and communicating with family members on coping mechanics. Step 3. Earn a graduate degree. While an undergraduate major in social work is not required for admittance into a Master of Science in Social Work (MS) program, most MSW programs grant advanced status for students with a BSW from an accredited institution. Graduate students can concentrate in a field such as medical social work, advancing and applying concepts learned from undergraduate study. A MSW program is typically 2 years long and consists of more than 900 hours of field work or an internship in a clinical setting where students practice as medical social workers while under supervision. Step 4. Become licensed. State social worker boards develop and enforce qualifications for licensure, which can vary from state to state. After earning a graduate degree, social workers need to accrue a minimum of 3,000 hours of supervised clinical experience, or have at least 2 years of work experience to be eligible for the licensure exam administered by the Association of Social Work Boards, ASWB. Successful completion of this exam results in the Licensed Clinical Social Worker, LCSW, designation. Step 5. Maintain licensure. Continuing education requirements to maintain your licensure varies by state. Professionals may consult with the ASWB to get information on the requirements for their state. Typically, states require social workers to earn continuing education credits every 2 years, according to the ASWB. This may be achieved through acquiring a certain number of clinical hours or completing some type of formal training or coursework in an area, such as substance abuse or domestic violence. In summary, medical social workers must have a Bachelor of Social Work, BSW, gain experience, become licensed, and maintain licensure.